Listening to Talk with Audrey. Current pandemic has upended so many aspects of everyday life, but for people considering pregnancy or already pregnant, those changes can feel even more overwhelming. I have joining me women's health expert and genetic counselor, Julia Wilkinson, and she has some ideas for you and your partner and what you can do during this time when you're at home to make sure that you're ready for your next appointment, either via telemedicine or in person. Welcome.
Thanks, Audrey.
Appreciate you joining me. I mean, just even thinking about going to your doctor's appointment if you're pregnant, it would seem to me would be fraught with a lot of anxiety, right?
Yes, well, and a lot of patients aren't able to go into a doctor's appointment. They're doing more and more over telehealth or only the patient's going and not their partner. So a lot has changed for most of my patients.
So would you say that telehealth is top of the list right now?
It is, and being able to prepare for that telehealth appointment is really important. I've done telehealth for over 6 years, and having all the information that you need at your fingertips is so helpful when you're trying to talk to somebody and you might have limited resources or you might just be on the phone not seeing them. So being prepared is really key.
So that being prepared means a lot of things. So say that you're not yet pregnant and you are thinking about getting pregnant. What can you do during this time that you're spending at home?
The few things that I would say are really key right now, first of all, is do some research. Think about your family history and your partner's family history and look into whether or not there might be any health concerns, things that you might be wanting to ask about in terms of your own health or for the health of that future child. And then also do tracking your cycles, especially when you're not pregnant yet. Now is the time to start figuring out how regular you are, how long they last, do you have any other complications each month with your cycle? And there's some great apps to help you do that so you don't forget. And while you're at it, organize all your medical records and gather them in one spot. Especially if you've been working with multiple doctors over the last 2 years, it's important that your current doctor has all of those records at their fingertips. They're not missing any pieces of information. And don't forget about things like vaccinations. Most of the time, we're not that worried about things that happened when you were a small child, but vaccinations are often in that pediatric medical record. And so we need to know what have you already had and what things might you need a booster for before you're pregnant versus the things that you might be able to keep getting done once you are pregnant. And then finally, the thing that I think is one of the most important things to do as a genetic counselor is to make sure that you get your genetic carrier screening done. And there are companies now like Invitae that are allowing you to do that right from home. So you can really do your homework, get some testing done, and be really prepared for that next appointment, whether or not that's in person or for telehealth.
Very interesting. So I've heard a lot about genetic testing. How do you do genetic testing at home?
It's really simple these days. Your doctor's office can order it and have Invitae send you a test kit, or you can actually go online to Invitae.com to begin the test ordering process right from there. A kit gets sent to your home, you spit into the saliva tube and send it back to the lab. In a couple of weeks, you have results and access to an interactive health report online. You have access to genetic counselors like myself. And then all of your records, any notes from any consultations that you have, everything can then be sent to your doctor's office as well. So they have the same information that we've talked about with you.
And why is genetic testing important?
So all of us have a chance to be carriers of different genetic conditions. And that is even with a negative family history and no matter what your ethnic background is. And so it's really important for us to do some testing so we can assess the risk for you and your partner to have a child who might be affected with one of these genetic conditions. And once we've assessed that risk, we can also start to think about, are there other tests that need to happen either prior to or during a pregnancy? Are there any additional precautions to be taken during pregnancy? And are there other things we need to do to prepare for delivery as well?
That's interesting. So if you just give us an example of some of the sorts of genetic tests that are available.
Sure. So it's a genetic carrier screening. At Invitae, we are testing around 300 different genetic conditions right now. So some of the most common ones that we see are things like cystic fibrosis, sickle cell disease, spinal muscular atrophy. These are all inherited conditions that can affect many different body parts and have a wide range of symptoms.
And by gathering that history, your family history, and of course your own medical history, does that sort of give you some insight to where you might be at risk or your child might be at risk?
There are some genetic conditions that are more common with individuals that have different ethnic backgrounds. And certainly if you know that there is a genetic disease that's running in the family, that would be really important information to make sure that we're definitely including that in your test. But really, when you're a carrier, most of the time, you as a carrier are perfectly healthy. And you wouldn't really know that you're a carrier until you do this testing. So even if there's no family history, this test can still show really important things that could impact your future children.
And would doctors, your OBGYN, do they automatically suggest genetic testing, or is that something that you have to ask for?
So most of the national organizations that the genetic counselors and the OBGYNs work with do recommend that this testing be offered to all women of reproductive age. However, a lot of times you're getting lots of different information about pregnancy, and so it's easy to sometimes overlook this part of it, which is why it's also really important for you to know that this is something that you can have done, and you can do it now, even before you get to that first appointment.
All right. Wow. This is very interesting. And one thing that keeps cycling through my head, you mentioned gathering your medical records. I never thought about the vaccinations that you had as a child. I don't think most of us even keep track of that, right?
You know, it's really funny because when I go and look at these medical records, as a child, it's it's something that's just automatically done. You finish your appointment and they give you a copy of things that include your height and your weight and your vaccinations that you've completed. As an adult, that just falls off the table. So it's something that sometimes we really don't think about. But there are some vaccinations that you really should have before getting pregnant and that are really not as safe to have once you already are. So it's important to try to get all the information you can so we can be as proactive as possible.
Counselor Julia Wilkinson, she's given us a lot of great information, so you don't have to stand still during this pandemic. You can do the work that you need to do on paper, on the ground, right now. Thanks so much for joining me.
Thanks for having me, Audrey.
My pleasure.